Hello, everyone, and thanks for being here. This is our Veteran Oral Health virtual road tour stop in the state of Massachusetts. We are going to start today with an introduction, a national overview of veteran oral health. We will then dive into veteran oral health in Massachusetts and follow that up with a discussion. At this point, we really want to hear from you all. A big part of what we're doing today is sharing resources, and another big part of it is hearing from you. We want to know if we're missing any big pieces in your state, and we use this feedback for future research and learning opportunities. So please do feel free to come on camera and share in the chat, but we are expecting to hear from you today. And later we will conclude with some action items and next steps to veteran oral health. A few housekeeping pieces. We are recording this session and we'll have the recording available afterwards on our website along with slides and other materials. Please chat and engage throughout, and please also share your email and organization in the chat at this time. If you have any questions, please also feel free to stick them in the chat and we will respond as soon as possible. These are our learning objectives here today. These were provided in the registration information and are attached to our CEUs. Our presenters do not have any disclosures to share today. And with us today is Liz Flannery, our Director of Education and Leadership here at the AIDPH, myself, Sam Lissette, the Community Education and Outreach Coordinator, and the person that we will thank today for gathering us all together is Lisa Laspina and the Better Oral Health Massachusetts Coalition. So thank you for your dedication to veteran oral health, Lisa. Alrighty, and before I hand it off to Liz, I'd like to start with a poll question for you to answer. I'd like to hear what you think are priority areas for veteran oral health in your state. So please go ahead now and answer that poll question. And I will also hand it off to Liz.
Thank you so much, Sam, and welcome everyone. Thank you for being here with us today. And thank you for participating. I think we have maybe there we go, 100% participation. So I'm seeing oral health literacy, which is really interesting, and then access to care, policy advocacy, and integration with general health care. So we're going to talk about all of those things. Thank you for participating. That helps me kind of understand where you're all starting at. And oh, it's hard to hear. Okay. Thank you, Tracy. Or Kathy, I'm sorry, excuse me. I'm just going to try to project. Sam, can you give me a thumbs up? Is that a little bit better? Okay. Thank you. So participating in this poll helps me have an understanding of where you're coming from and where your priority areas are as we go through the presentation and make sure we're hitting those pieces. And also we can consider what to do with the information that we're going to cover here today. So I'll pop those up real quick. Folks can take a look. We can head to the next slide, Sam, if that's okay. Okay. So before we really dive into our full presentation here today, I'm just going to give a little bit of an overview of AIDPH, or the American Institute of Dental Public Health. As Sam said, I'm the Director of Education and Leadership here at AIDPH. Our mission is to empower our community to advance oral health through science, education, and advocacy. So we have a research and impact team that did the work to find the data, analyze the data, and publish the reports that we're going to talk about here today. So this programming is really the intersection of our three focus areas. We're taking our research and impact team's work and we're pulling it into an educational program, talking to our community so that you can use it as oral health advocates in your community, use that research and go out, whether you're using the data for a grant application or you're using it to talk to a decision maker or do policy advocacy. We really want these as usable tools. So as Sam said, we really want to hear from you what we're missing and how we can best shape the tools we have so they're usable for you. We're doing this work because our vision is a justice-oriented oral health system. So really looking at the system level of changes we can make so everyone has access to equitable oral health. Can head to the next slide. At AIDPH, we have 4 communities of focus. That includes veterans, which we're talking about here today, people in rural communities, LGBTQIA plus people, and people with disabilities. And of course, we recognize that there's intersectionality among all of these communities, and we will get into that a little bit more when we're talking about the report and our data around veterans. For example, veterans are disproportionately located in rural areas, so we'll talk about that a little bit more. We can head to the next slide. We want to say thank you to CareQuest Institute of Oral Health. You folks in Massachusetts are probably familiar with CareQuest. They have worked with us on our veteran oral health research for many years. We can head to the next slide and take a look at kind of what that timeline looked like. We launched with them in 2021, launching our first survey on veteran oral health, and that really kicked us off on developing a large body of in-depth veteran oral health work and analysis, working with both publicly available data sets as well as unique qualitative data that we generated through surveys with our veteran oral health and veteran partnerships in the community. You can head to the next slide. So we are talking about Massachusetts specifically here today, but we want to start with a veteran oral health overview and what that looks nationally, because it's really level sets where we are, how we got here, and how that impacts what veteran oral health looks like at your state. So we can head to the next slide. So the first thing, and potentially the most important thing to know, is that VA dental care is mandated. Medical and dental benefits are determined by Congress and are regulated by Title 38 of the Federal Code. That means that when we're talking about dental eligibility through the VA for veterans, to change what that eligibility is takes an act of Congress. So that's important to know when we're talking about systems change and kind of how what situation impacts what we're looking at with the details. We can head to the next slide. So when we talk about eligibility, we always like to start, again, looking at the national level and level setting, doing this work and going from state to state and having these conversations. What we've really found is that a lot of folks don't know that most veterans aren't eligible for dental care through the VA. So these numbers are actually slightly adjusted. There's new information that came out from the VA. So the numbers that I'm going to talk about now are slightly adjusted as of 2024 and the latest fiscal year information, but fairly accurate, still pretty on par. So if we look at all of the veterans in the US, there's about 18 million, and above those, about 9 million receive health care through the VA. Of those that are receiving their general health care through the VA, only about 1.8 million are eligible for dental care. To be eligible for dental care, there's a lot of nuance and a lot of technical pieces to it, but essentially you have to be 100% disabled, a rating of 100% disability, to receive dental care through the VA. We saw this number, this 1.8 million number, tick up a little bit with the PAC Act because it expanded that disability rating. And so as a consequence, additional folks were eligible for dental care through the VA. So that's eligibility. And then when we're looking at utilization rates, we see that it's even lower. So only about a third of those eligible actually receive dental care through the VA. We aren't exactly sure why. We could make some educated guesses based on the work we've done, but we need more data to understand why that utilization rate is even lower. We can head to the next slide. Okay, so this is taking a look at chronic disease in veterans, which we're going to dive into a little bit more. We can head to the next slide. Looking at chronic disease in veterans is really important because we understand really that systemic oral health connection and how preventative oral health care can really impact chronic disease. That's really important when we're looking at the veteran population who disproportionately have higher incidence and rates of chronic disease, and also when we're looking at serving them in an integrated care, that I think that came up as one of our important focus areas. When we're looking at somewhere like the VA that's very well positioned for integrated care environment, and why that could be a cost savings and a better health impact. So our data shows nationally, after controlling for factors like income, education, rurality, veterans with diabetes were about 40% more likely to be edentulous or have lost all of their natural teeth than veterans without diabetes. We see very similar things when we look at heart disease. We can go to the next slide and look at that. And so again, controlling for the same factors, veterans with heart disease are about 30% more likely to be edentulous than veterans without heart disease. You can head to the next slide. And so when we look at that from a monetary perspective, we find that there can be savings. So that for every dollar invested in preventative dental care for veterans, $1 is saved in diabetes care management and $2 are saved for heart disease management. So again, when we're talking to decision makers and we're looking at this from a policy perspective, we know that the most important thing is better health outcomes, equitable health outcomes, better health outcomes for our veterans. But in addition to that, there's a healthcare savings across the health system when this preventative oral healthcare is received and available. You can head to the next slide. So just highlighting kind of where am I getting this information. Again, we have several publications on veteran oral health. They are all available on our website as well as available on vetdentaldata.org. We'll post those in the chat for you. And just want to share, our goal at AIDPH is always to make our research as accessible as possible. So all of our publications are open, and additionally, we design them in a way that are really translational. So translational science is one of our main goals, not research for research sake, but to take the research that we have done and put them into well-designed tools so that folks, even if they aren't data analysts, can go and use them in their community with the work they're doing. Again, for those grant applications, for those discussions with decision makers. So when you look at our publications, you'll find that they have a lot of graphics. There's a lot of executive summaries and one-pagers so that you can print out a resource if you're going into a meeting. And really take that data and be able to present it really quickly at a high level to folks. If you have any questions about those, you can let us know. On Vet Dental Data, that's also where the state profiles are, which we're going to dive into the Massachusetts state profile here in just a second, as well as an interactive dashboard where you can change the categories, move it around, and really find the data that's most applicable to your location. So I encourage you to take a look. I'm going to pop it in the chat here. .org. And if you haven't already pulled up the Massachusetts state profile, I encourage you to pull that up and take a look and follow along as we walk through, which is what I'm going to do now. We can head to the next slide. And the next one. So I just also have to say quickly, I am thrilled to be here with Massachusetts today. While I don't currently live in Massachusetts, I'm born and raised New Englander from Massachusetts. So I'm thrilled to be here with all of you with my home state and really excited to look at what veteran oral health looks like in Massachusetts. So again, we're going to kind of go through what the state profile looks like, talk about that information, the impacts, why the gradings are what they are, why the standards are what they are, and how also we got there, what the lessons learned. And the reason that we put these state profiles together as an organization, again, we started nationally looking at veteran oral health, and then we were getting more and more questions about what things look like in folks' states. So we drilled down and did state profiles again and designed them in a way so that folks could use them in their day-to-day work. And then we're doing this virtual road tour to call out these resources to hopefully get them in the hands of the most folks at the local level as possible. Can head to the next slide. Okay, so oral health of veterans living in Massachusetts. So when you're looking at our state profiles, at the very top, we have kind of level setting of what veteran oral health is nationally. Again, going back to that piece of what we found is really a lot of people don't understand that the majority of veterans are not eligible for dental care through the VA. So we kind of start with a level setting of what that is, how that works to orient folks to the scenario. Then we look at the population. So we're looking at Massachusetts, 5.4% of the state population, or about 305,000 people, are veterans. And then we can drill down and look at things at the county level. And so you heard me mention earlier on the call that veterans are disproportionately located in rural areas. So we look at Massachusetts and we see what counties have the highest veteran population, and that's Barnstable, Franklin, and Berkshire. And I think when we're talking about rurality, it's no surprise that Berkshire County has a high population of veterans. And we also know that that means their access is probably a little more dispersed. Their travel time to get to care is longer. And so that throws up some additional barriers for them. So again, we have this state profile, and on vetdentaldata.org, we have an interactive dashboard where you can drill down into this information. So when you're thinking through policies and programs, having this county level information really helps understand maybe where to focus or where to implement. We can head to the next slide. Okay. So pulling out some state-specific insights here and looking at Massachusetts versus a national comparison is really important, because if we're presenting the information without context around it, we say, well, what does that mean if we don't have a larger context to look at that data in? You say, is it good? Is it bad? We're not sure. So this compares it nationally. And the other thing I want to call out that we know that folks have found really helpful is pulling up, there's a state profile for every state in the country. And so you can pull yours up and compare it to national data, but you can also pull up neighboring states or states that have similar systems and programs and look at their data and how you compare to them and how they compare nationally. And that can be really helpful for understanding where you are. It can also be helpful for networking. If you know folks doing programming, you can say, how did you get here? How did you excel at this piece? And really kind of make those connections and follow lessons learned. So if you're presenting this information to somebody who's a policymaker, even another veteran or a program leader who doesn't understand the context, this is really helpful, and again, graphically oriented. So if we're looking at the specifics, again, the national versus Massachusetts, we have the rural piece there on that dog tag graphic. Without numbers there, that indicates that there isn't rural specific data available in Massachusetts. And I'm calling that out because part of reviewing this information and having these community conversations is identifying data gaps. And so I'm calling out that piece if you're ever in the opportunity to be pursuing research in Massachusetts or talking with colleagues about where those data gaps are. Rurality is a piece of that. And then looking at the state ranking across 4 conditions: edentulosum, heart disease, diabetes, uninsured, right? We know that edentulosum is the worst oral health outcome. We know that of that connection between heart disease and diabetes, and then being uninsured obviously is a main barrier to accessing care. The thing to note is that worst is number 1. So if we're looking at heart disease, that's a pretty poor rating. But if we're looking at diabetes, that's a pretty good rating for Massachusetts. Uninsured, edentulosum not great. Uninsured around the kind of middle mark. We can head to the next slide. I also want to pause and say, if folks have questions about this as I'm going through, please feel free to put them in the chat. We can pause and answer questions. Again, this is meant to be interactive. And if folks are watching this asynchronously and have questions pop up, please feel free to email us. We're always happy to chat and talk through the data. So this is diving down in kind of the next section of the state profile, which again is very oriented as a report card. We chose that format because I think we all have experience with report cards in our lives. It's a kind of easy notation to understand and look at that. And if we look at Massachusetts, again, my home state, I don't want to be too self-congratulatory here, but Massachusetts is doing pretty well when we look at some of these pieces, the uninsured piece, the diabetes, the dental visits. And so something I would note here too, again, this varies wildly from state to state. Some of these states are getting Fs, some of them have Cs, Ds, some of them might have a C or a D in one area and an A in another area. And something we like to point out is this isn't just, oh, we have a B, that's great, we're floating along, or we have an A in this category, so all set. It's looking at those areas that are doing well and then looking at the systems in place that led to that. And as public health, dental public health, oral health professionals in the area, you probably have an understanding of the programs and policies that are in place that allow you to have an A in that area. So if you have an A in one area and a B or a worse grade somewhere else, it's looking and saying, what can we pull from the A? What lessons learned? What worked well? And how can we apply it to this area where we need improvement? Or how can we share that information with a neighboring state or another state in the country? That I have this colleague who's working on a program and wants a program or a framework that worked well and was successful, and why. Kind of having those conversations and understanding the overall situation, even if there is a good grade. I think having this be a facilitator of those conversations at the program level and amongst colleagues can be really important and really helpful when we're talking about making change and also kind of program and policy evaluation, right? That's a major part of public health programming. We're continually doing M&E, continually looking and making sure we're staying on track. So if we have A, what's there? What do we need to make sure that doesn't change? Again, especially when things come to policy and legislation. So we can head to the next slide. And again, we would love to hear from you. If you can take a moment and put in the chat, were you surprised by the state profile and the grading? And again, going back to that piece, are there data gaps that you think should be explored in Massachusetts? We know that there's a data gap around virality. Are there other pieces that you see? Tracy, I see that you were not surprised, so that's great. And Kathy, you weren't surprised either. Okay, wonderful. If there are pieces that you're thinking through with data gaps and there's other pieces that you see in your everyday programming and work, I would love to hear that in the chat as well. Can head to the next slide. Okay, so we've talked about this a bit kind of throughout the presentation, but how can you use this state profile? Advocacy. So, and we also like to kind of level set and share advocacy can be an intimidating word. It also, I think a lot of folks immediately go to legislation and we're advocating for legislative change, which certainly can be advocacy. But advocacy can also be a smaller level. It can be on a more local level. And it can include things like clinical changes that improve access. So something that we find a lot is that folks don't even know veteran status of their patients. And so changing clinic intake forms to have veteran status on there can be a really major impact, both for direct clinical care giving, trauma-informed care implementation, and data collection and understanding can give us more insight into who our patients are, what those utilization rates are, where veterans are getting their care. So when we're talking about advocacy, it can be really big P policy all the way down to that small p in our clinic, what changes we can make to address veteran oral health care. And it might just be starting with, are we treating veterans? Educating stakeholders. So health literacy, oral health literacy came up at the beginning of this call. So again, stakeholders can be policymakers, folks at the state level, all the way down to those local institutions and those one-on-one clinic institutions. So again, we aren't exactly sure why utilization rates are low. We do know that the system is really complicated and sometimes folks don't understand their eligibility. So again, going back and having these conversations, are you working with veterans? What conversations are you having with them? Pulling in that health literacy as well as eligibility literacy piece can be really important, and hopefully this data can help. Chapter 116, benefits from mass vet agents. I don't. Chris, can you tell me more? Is the agents part, can you explain that a little bit more to me? I might be able to jump, or we can look and see if we have more info. I'll let you, if you could put that in the chat, that would be great. Okay, so decision making, again, looking at your programming and deciding where you want to go. Hopefully this could maybe show where the work needs to be done. Again, looking at rurality, looking at Berkshire County, understanding where we're implementing things, understanding what our next steps would be, monitoring what's doing well and ensuring that's staying on track while taking the lessons learned to pieces that need improvement. And reports and grants. Again, our hope is, I've had folks come and say, can we use this? Can I put this in a grant report? And we say, yes, please do. Again, translational science is always our goal. Our goal is to have our research openly available, but also really usable. So pulling out those high level numbers and popping them in, that would thrill us if you're putting those in your grant applications and reports. So if you ever have any questions about that or need support on that, please let us know. You can head to the next slide. I'm reading the chat with Chris. Okay, vet agent. Okay. That's really interesting. I don't know chapter 116, but I would love to connect on that. So it's actually the perfect slide. So we're going to highlight our veteran oral health in Iowa report. And so just talking about this is a more in-depth report that we did specific to Iowa through funding with Delta Dental of Iowa Foundation. They have a focus on veteran oral health. And so we're actually headed into our third year of working with them. We did a full year of analysis and published a full report, I think was about 75 pages, dialing down with, again, that publicly available data as well as stakeholder surveys and interviews to look at a mixed methods analysis of what veteran oral health was in Iowa. So we highlight this because kind of if states and communities are seeing a problem with veteran oral health, we really kind of hold this as a best practice standard of the work you can do to get the data to inform additional programming. So we published this report. We spent last year engaging with stakeholders in Iowa, sharing the information, having community discussion about what data gaps they were seeing, what resources they needed. We held a state summit to pull folks together. In our report, we had published, I think there were 40 strategic recommendations broken down by, for policymakers, for clinicians, for advocates. We had folks come in person and really dial into what were the most impactful and achievable of those strategic recommendations and develop out pathways of how they can implement them. And now we're working with the stakeholder groups to develop a strategic plan so they can implement these programs in a data-informed way. So I share this. We like to highlight it as a best practice, but it's great that it came up right at the time that you're putting your comments in there, Chris, because so Iowa has VSOs, which I have a sense are similar to what you're talking about as the vet agent. And I see, okay, so they work directly to kind of care connections with veterans. I see they pay a portion of eligible that's dental costs. Okay, great. I'm gonna look into that a little bit more. I love that. So Iowa, they have a trust fund for veteran oral health. And so they pull that, and that's something that states have really found as a best practice. I don't know, Sam, can you head to the next slide? So these were just kind of the top strategic recommendations. Again, there was about 40 total. But looking at that trust fund support and how that is doled out, which is done in conjunction with those VSOs. So Chris, it would be great to connect and learn more about that program in Massachusetts and kind of understand the similarities and the differences. I know a lot of other states have found Iowa's trust fund program and framework really helpful and as a potential path forward to increasing access to care. So I'm sorry I don't have more information, but I appreciate you bringing it up, and I would love to connect and dive into that more if that's okay. If you are so inclined, if you share your email, you could direct message me, or you could post it in the chat if you're so willing. Can we head to the next slide, Sam? Okay. So this is our discussion point. We can head to the next slide. Okay. So we want to hear from you. Again, I appreciate everyone being so active in the chat. You can put it in the chat. We would love for you to come off camera and share. Sam, do you mind? Actually, I have them here. Let me pull them up and post them. Okay. So we can dive into any or all first, but our first question that we have is, what next steps seem viable for you or your organization to take in advancing veteran oral health? And I know many folks said that they weren't surprised. So maybe thank you, Chris, for posting that. I appreciate that. I'll reach out. Maybe you are working with programming or veterans in your everyday work where it's already going well and it's already successful. So if folks are willing to share a little bit more about that, about maybe why they weren't surprised, and what they can do to maintain, or if there's other places to improve. I'd love folks to, again, post it in the chat or just come off mute and share.
Good afternoon. I'll start. I'm Tracy. I used to be a contract dental hygienist for the military, so that's why I'm not surprised about the lack of oral care for veterans. I worked for 15 years in Willow Grove, Pennsylvania. So that being said, that's why I was not surprised about the lack of care. Here at MCPHS, we have a Forsyth School of Dental Hygiene, and we provide vouchers for free care for veterans. We have a Veterans Inc., which is literally 3 blocks from our facility, and we have reached out to them on many occasions, even to a point where I wrote a grant that was not funded through CareQuest. And the goal would be to use a grant to buy portable equipment and have that equipment stationed at the facility. The facility is huge. It looks like a renovated castle. So it looks like, or it's an old fort, so it really is. And the goal would be to have, had I won the grant, then we would have gotten portable equipment stationed at this facility, and then our dental hygiene students would have been able to provide on-site dental hygiene care, preventive services. The other challenge here in Worcester, I'm in Worcester, Massachusetts, I'm sorry. The other challenge is that once we find decay, where do those veterans go for care? We have maybe 4 public facilities here, and we need all of them on board with a voucher system or this the Iowa template, so that they can provide free care for our veterans. So I think those are some of the challenges that we face. Preventive care, yes. Trying to gain inroads with regard to public health facilities to provide comprehensive dental care, not so successful. And then also just making inroads with the veterans facility, which is 3 blocks away. Our dental hygiene students have participated in public health events. They served breakfast not too long ago, the parade. We try as much as possible to have our hygiene students fully integrated. And again, we have taken flyers down there. We've given lectures, seminars. It's just, I think because that facility also houses veterans who are substance and mental abuse issues, that have substance abuse and mental health issues. I think some of that some of those issues come into play when we talk about trying to get them to walk 3 blocks for preventive care, and it's free. But I think their concern is more so the substance abuse issue or the mental health aspect. I think, again, if you look at, Bloom's taxonomy of the hierarchy of needs, dental is at the bottom of their list unless there's pain. And so I don't know how we can reemphasize preventive care. We do our best here in Worcester, Massachusetts, and hopefully other sites are doing the same thing. Thank you.
Thank you, Tracy. That was really wonderful. And thank you for the work you're doing. So I think what I'm hearing is there is a need for greater service to go beyond the preventative care when things are found, to connect folks with maybe a dental home or more comprehensive care. And I think that really speaks to the piece that we see that intersectionality and that connection with chronic disease. And that's why we say the VA is the best place for veterans to be treated, because they're set up to be an integrated care management system that really pulls those pieces together. So more support for greater services, and then also that kind of community engaged piece of you're really doing everything in your toolbox to get in front of veterans, but getting in the door can still be tricky because of those additional conditions that are going on. So again, tricky, complex, multiple things going on. So I thank you for your work and staying dedicated and applying to those grants and continuing to find ways to meet those needs. So thank you. What else comes up for folks? I see you posted something, Chris, in the chat. Is that, that's direct, sorry. I will look at that document. What else comes up for folks that they want to share about the work that they're doing? And it can be a success story, it can be a pain point, can be what you're working on next to advance the work that you're doing. I also wonder, again, I'm not currently in Massachusetts, but anecdotally know from my family, from my grandparents, my grandfather goes to the VA, does not get his dental care there. I think, Massachusetts, we have a pretty unique medical community. And while nothing is perfect, some may be more advanced healthcare systems in place in other states. And what I hear a lot is, we talked about rurality when we were looking at Western Massachusetts, but that rurality is also coming from New Hampshire, Vermont, Maine, and working and talking to folks about this in New Hampshire, Maine, and anecdotally from my family of busing veterans down to dental care in Massachusetts because it's just not available at all for folks in Maine or New Hampshire, and finding those clinics. Is that something that impacts the work that anyone is doing? Is there an influx there, or is an impact not seen on the work you guys are doing? Okay. I'm hearing that that's maybe not an impact. So the last question we want to ask, again, going back to the piece of ensuring that we're offering the most useful tools and resources to folks, what other resources would help you in your work with veteran oral health? And I'm going to see Kathy. Tufts, we go to New England Center and Home Veterans. Okay. So Kathy's saying at Tufts, they go to New England Center and Home for Veterans and to Brighton Marine to conduct oral health screenings. We have had grants and then cover the costs for underinsured and uninsured, but getting new grants is challenging. That's totally fine. We're all always multitasking, right, Kathy? Thank you for sharing. I appreciate that. Um, and I wonder too, Tracy shared applying for a grant and not getting it. Is it even finding the grants, finding grant options, or is it being successfully awarded? I wonder what the biggest pain point is there, and if there's resources that could help with that. So, in connection with that, are there other tools from a data, from a technical assistance, from a community engagement connection perspective that would be helpful for AIDPH to do that would help in your work?
But there's something in the chat about what Kathy does at Tufts. Did you see that?
I did. Yes, I did. Thank you. And I'm going to pull up to a poll. Let's see. Chris says, in my former job, I received grants not specifically for vet. Sustainability was difficult. Yes, that's something we encounter ourselves, kind of that work of, and I think in public health in general, that's always the question, right? If we're getting, sometimes you need a small grant to get started and then to launch the program. If it's only covering a couple years, you're doing the work plus trying to find additional funding as you go through. So I'm not sure I have an answer, but I certainly have empathy and understanding. Solidarity maybe is a better word for that. And also something as public health professionals, looking at policy and legislation that can be other sources of funding. Okay, I'm gonna pull up polls right now. And I mentioned Iowa's trust fund. I know that there's a program in Maine. We have a colleague who's been doing a fair amount of veteran oral health work with that she was able to start, I think, through the local government and then get additional grant funding for. That was a similar not they're not calling it a trust fund, but it was like an award program where they were awarding funding to veterans for the insurance and or the care to fund those veterans getting their oral health care, and has been fairly successful with that work. So if anyone's interested in that, with a local New Englander in Maine doing that programming, please reach out to me. I'm happy to connect you to that colleague who's doing that work in Maine. Okay. Okay. Sorry, I'm having a hard time getting my polls to show up.
Liz, do you want me to see if I can grab one?
Maybe if you can, it's only letting me do the poll that we already launched. So, oh, wait a minute. I think I figured it out. Okay, I got it. So we want to hear from you again, giving you some options of pieces that would be most helpful to working in veteran oral health and advancing the work that you're doing. So we have educational materials, policy briefs, research finding, and training modules. I'm seeing the education materials and the training modules. I will also share policy briefs, research findings. Thank you. I think we still have some folks to respond. Another piece that we do have that is not veteran specific, it's actually for folks with disabilities, but we just published an advocacy toolkit for working on advocacy around Medicare for people with disabilities and oral health access, dental care access. Obviously, that's a bit of a different population, and there's going to be some specifics in there. But if you are doing advocacy work, either professionally or you're looking to do it personally with your volunteer work, there's a lot of general lessons on developing an advocacy plan in those toolkits that are available on our website. So I suggest those as well if that's a piece that folks are interested in. We have recordings of the webinars we did on those as well, which kind of serve as almost a training module. Okay, I'm going to end this and share it. Thank you, everyone. So again, I'm seeing really high on that training module piece. If anyone's willing to either share off mute or put in the chat, training specifically, is it, I'm hearing a lot about grants. So I'm wondering if it's training around leveraging data in grants or having a higher success rate with awarding with grants. I'm making a guess based on what folks have already shared, but if you want to put specifically on what training piece would be helpful, that would be great. Research findings, policy briefs, educational materials, all kind of equally important, just behind that training module. So that's really wonderful. Again, we post all of our recordings. So if folks have colleagues that you're thinking of that you think would be interested in this material, please share. We will post this recording. We will share it out with Lisa, who can share it out with your coalition. We post those on our website. We post our research findings. We're continually doing work. So if you have, again, if something occurs to you with that data gap piece, please share it with us. We're happy to, not happy, our model is a community engaged model. So we are looking to hear from the community and the folks who are doing the work about what is needed. So please tell us. And again, if you have specifics on that training piece, I would love to hear that as well, and we're happy to share out. If you are not already subscribed to our newsletter, please do so. It shares out when we're doing additional webinars on veteran oral health, rural health, people with disabilities, etc. Sam, do you want to bring up our slide deck and we'll just kind of talk through next steps? So we have CEUs available for our session. And Sam, actually, are you able to, awesome, thank you so much. So Sam just posted this. I just want to note we are hosting, if you have participated in any of our programming before, we are hosting our CEUs on a new platform. We have a digital learning space for our academy, which is the full offering of all of our educational programming. So under our education team academy, we have everything from a standalone webinar like this. We have series where folks can attend one or can attend all and earn a certificate at the end in the topic area of interest. We have more intensive and in-depth fellowships all the way up to our annual in-person conference, which is our colloquium. We have our 2025 one. We just opened registration in case folks are interested in meeting in person in Chicago in February, which I know sounds thrilling and freezing, but it's going to be very exciting. It's ahead of midwinter. So this link here, when you click on it to get your CEU, it will say register. It is free to register. It will set you up with a username and password, and then it will house your CEU there. If that's the only one you get from us, it will be there. You can see our other offerings. You can also, it will host your other CEUs if you participate in our rural oral health seminar series or something else. So again, I mentioned that our recordings and resources will be available on the website and the Academy. You can find links from today's resources on vetdentaldata.org. Again, there's also, in addition to being able to download all of our publications, there's an interactive dashboard. So if you're looking to dive into the data more, please visit that. And if questions come up, please let us know. You can head to the next slide. And to end us out, we believe that veterans deserve equitable oral health. So we say thank you for being with us here today. Thank you for doing this work. You all are deeply entrenched in this work in your day-to-day work. So thank you for that. Thank you for being here and engaging in the chat and engaging in person. Lisa, did you have something to share?
No, I just wanted to say thank you so much for all your hard work.
Thank you. And again, thank you for letting me have a little bit of New England today. I was thrilled to be here with you all, and I hope everyone has a wonderful rest of the day.
Take care. Bye-bye.
Take care. Bye-bye.
Bye.